Up next on CBC, a clinic in Winnipeg is giving people a free way to test their drugs for fentanyl, so people know whether or not the deadly opioid is in their drugs before they take them. And the tests are being distributed in a pretty unique way. Madison Eldridge is a journalism student who's been interning here with CBC Manitoba, and she's in studio to tell us more about how all of this works. Good morning.
Good morning.
So can you describe how this clinic is distributing these test strips?
Yeah, so when you walk into NorWest Community Co-op Clinic, you could almost miss it. But tucked into the corner is this large, 6-foot-tall touchscreen box. So there's various messages that appear on it with some photos and messages, again, that are warning people about the toxic drug supply. If you think about those like digital maps that you can find in the mall, you like search up the store and where you're going, it kind of looks like that, except for it's a vending machine. So this is Norwest's Health Box. It gives out free harm reduction and wellness supplies. You can scroll through all the products that are inside. It shows little pictures of them. And some of the stuff includes like HIV test kits, granola bars, hygiene kits, naloxone, and of course the newest is the fentanyl test strip kits. To use it, you just have to sign in or create an account. You choose the year you were born, your favorite color, and an animal, and then you can choose any items you want without being questioned. And Jennifer Gourlay, who's a primary care nurse with the clinic, she says this privacy is really important.
People who may use substances or use drugs may feel judged by the healthcare system. And so if they have to walk up to the front desk to ask for supplies, it's that interaction that may prevent them. There may be some shame, some stigma, some embarrassment with it. And this helps to reduce that part.
So tell us about the newest item to be added to the box, this fentanyl test strip.
Yeah, so I actually sat down with Kaisala Bora. She's another primary care nurse from Norwest. And after taking the kit out of the vending machine, she actually unpacked the kit for us.
Comes with a measuring cup, a 30 ml measuring cup, 3 fentanyl test strips, a pamphlet, a stirring stick, a little baggie, and the client would have their substance. You could use it with liquid, powder, rocks.
Yeah, so the test strip itself, it's like a small white strip, and I think pool owners will understand what I mean. You know those water strips that you can use to test your pool water?
Yeah, to see how much chlorine or what's going on in there, right?
Yeah, exactly. So it looks like that. It's about that size. But to do the test, after you peel open the package, you're going to take a tiny scoop of the drug sample, like the size of like a head of a match, so it's really small, and you mix it into a little cup of water, and then the test strip goes in there, and you're going to hold it in there for 15 seconds. And then, unlike the water testing kit, though, it doesn't reveal fun colors. So it's 1 red line for a positive result, and then 2 lines for a negative result. And these test strips, they can be bought on Amazon. They're also used by other drug testing facilities. So it's not a new invention, but it is new to the Norwest Health Box.
Do they have a sense how effective, the test strips are?
Well, the Norwest kit comes with 3 tests because the results can be unreliable. Health Canada also warns about the limits of these tests because initially they were developed to test urine for fentanyl for forensic purposes. So they're not 100% reliable when testing street drugs. False negatives and false positives do happen, and there's a list of factors that can impact the results, including the room temperature and the expiry date of the test. So this unreliability can give people a false sense of confidence that the drugs they're using are free of fentanyl.
The other thing too is, although it can detect fentanyl, it can't detect some fentanyl analogs, such as carfentanil. And so that's really important because despite using this, if you do get a negative result, an overdose is still possible. So there are definite limitations to the tests, but again, it is another harm reduction tool that adds to the other initiatives that we do here at Norwest.
Now, some people might be wondering if the test doesn't guarantee reliability, then why use it?
Yeah, so Abora explained that even with its limitations, the test still promotes safe consumption. There's a 2022 report by Nine Circles, which is another local health center, and they did a pilot program to test these strips and how effective they are. And it said that some substance users who found fentanyl in their drugs actually changed their consumption habits. So some would take less of the drug, diluted it, or they chose not to use it at all if they found fentanyl in it. So this is seen as a positive tool to help prevent overdose, but there is another thing to consider. So even though some substance users may be using the strip to avoid fentanyl, Abora says she's aware that others may be using the test to find it.
Some clients or some people who use drugs are looking to use an opioid, and so some people use it to see if there is fentanyl, and they will use it. And so one of our strategies to prevent overdose is also including a pamphlet in here that goes over tips on how to be safe with it, like having naloxone, never using alone. We've also made a video that we're hoping to put on our website and on the Health Box to also help prevent any overdose.
That's super interesting. What kind of feedback is the clinic getting about the new strips?
Yeah, so Gourlay says that the feedback of the community is the most important thing about the box. It was based on the needs of the community that these strips were added to the box in the first place. And she says that the nurses at the clinic are open to incorporating other items based on the needs of the community and what they're saying. It's really a team effort to keep the box up and running in the clinic. Talking with Gourlay, I could really see her eyes light up when she talked about all of the work they're doing to try and help make these tools more accessible at NorWest. So the nurses do stock the box twice a day. They spend the time putting the packages together, and Gourlay says that they do this to help make harm reduction supplies more accessible, especially to more vulnerable communities who maybe can't afford to buy these items on their own.
25% of the access is women, identify as women. Another 26% identify as Indigenous. Another 26% identify as people who use substances. So that's who's accessing the machine. And we're hoping that by them coming into the building, accessing this machine, they interact a lot with security, with our front desk. And we're really hoping that having access to this builds trust, so they can come in and access healthcare other services that we provide as well.
Yeah, so Abora says so far 11 test strip kits have been given out since they were added to the Health Box.
All right, thanks for coming in with us, Madison. Appreciate it.
Thanks.